Hello. A variety of inhaler devices are available to treat lung conditions. This video will show you how to use your Respimat inhaler. If you use your inhaler correctly, you'll get more of the medication into your lungs, giving you better control of your breathing problem. But if used incorrectly, you may have poor control of your condition, with the risk of side effects, such as a sore throat or mouth infection. Before using your Respimat inhaler for the first time, you need to insert a cartridge of medication. With the cap in place, press the safety catch and pull off the clear base. Insert the narrow end of the cartridge into the inhaler. Push the bottom of the cartridge against a hard surface to ensure it has gone in all of the way. Replace the clear base. You now need to prime the inhaler. Twist the base in the direction of the arrows on the label until you hear a click, about half a turn. Flip the cap until it clicks into the open position. Point the inhaler to the ground and press the dose release button once and then close the cap. You need to repeat this sequence of twisting the base, opening the cap, pressing the dose release button and closing the cap until a cloud of medication is visible. Once you see a cloud, you need to repeat the process 3 more times before your inhaler is ready to be used. You should always sit upright or stand up when using your inhaler. Hold the Respimat upright with the cap closed. As before, turn the base of the inhaler in the direction of the arrows on the label until it clicks. Open the cap until it clicks into the open position. When you're ready, breathe out gently as far and as comfortably as you can, but not into the mouthpiece. Now place the mouthpiece into your mouth and between your teeth, but don't bite down on it. Close your lips around the mouthpiece to form a tight seal. Be careful not to cover the air vent with your fingers. Make sure that the inhaler is horizontal, with the mouthpiece pointing directly to the back of your throat. Start breathing in slowly and deeply through your mouth before pressing the dose release button. Continue to breathe in slowly for as long as you can. Remove the inhaler from your mouth while holding your breath for up to 10 seconds, or for as long as is comfortable. Now breathe out slowly and gently away from the mouthpiece. In order to take a full dose of medication, you need to inhale 2 puffs of medication. So after the first puff, breathe out fully and repeat the process. Once complete, close the cap. A click indicates that it's closed securely. If your inhaler contains a steroid, brush your teeth or rinse your mouth with water and spit it out after every use to prevent mouth infections. Ask your pharmacist if you're unsure whether your inhaler contains a steroid. To keep your inhaler in good working condition, you should follow our care advice. Do not remove the cartridge once it has been inserted. If the Respimat has not been used for more than 7 days, you should release 1 puff towards the ground before using it. If the Respimat inhaler has not been used for 21 days, it should be primed again. Throw away your inhaler after you've been using it for 3 months. You should clean the mouthpiece of your inhaler, including the metal part inside, with a damp cloth or tissue at least once a week. There are a few common problems people encounter with their Respimat inhaler. If the base of your inhaler does not turn easily, it either means that the inhaler is ready to use or it's empty and you need to start a new inhaler. If you can't press the dose release button, it means that you've not turned the base far enough. If the base springs back after you turn it, you've not turned it far enough. Remember to listen for the click when you turn the base. If you're able to turn the base further than usual, it may mean that the dose release button has been pressed. To solve the problem, close the cap and start again. A dose indicator on the inhaler will tell you approximately how many doses you have left. When the dose indicator enters the red area of the scale, there is approximately 7 days' worth of medication left. Once the dose indicator reaches the end of the scale, the inhaler is empty and locks automatically, so no more doses can be released. If you're unsure about how to use your Respimat inhaler or have any other questions, speak to your GP, practice nurse or pharmacist for assistance.